There's a stark warning tonight that millions of children in Yemen could be pushed to the brink of starvation.
New research by UNICEF, the Ministry of Public Health and partners, shows that global acute malnutrition rates for children under 5 in 9 of Chad's Sahel regions are above the World Health Organization's emergency threshold of 15%.
Over 250 million children are currently suffering from the issue of malnutrition in 2020 alone. And without a shadow of a doubt, the impact the COVID pandemic has on this issue is dreadful to say the least. The first Sustainable Development Goals, dedicated to eradicating poverty in all of its forms, also aims to tackle this issue of malnourishment among children in LEDCs as well. By 2030, we aim to achieve the target of ultimately combating the issue of extreme poverty, of people living under $1.25 a day, unable to access basic human necessities such as food, clothing, and shelter. My name is Muhammad Alif Naufal, and I'm the head chair of SDG 1 in the upcoming MSMUN conference, a conference that gives an opportunity for middle school students to learn about the most serious global issues and to work as United Nations delegates to find answers to those problems. Malnutrition refers to the imbalance, both deficient or excess, of food and nutrients intake. This issue is prevalent globally, but it is much more severe in less economically developed countries, where access to food is significantly more limited and education about properly balanced diets are restricted. Around 45% of deaths among children under the age of 5 years old are related to undernutrition in some way. Undernutrition is defined as the deficiency of one or more essential nutrients. 155 million children in 2016 alone face stunted growth, which is caused by inadequate nutritional intake. Not only is malnutrition caused by the lack of access to food, social issues such as poor education are at play as well. Economic factors such as poor infrastructure, lack of access to clean water, low income, and many more also add on to cause the issue. There are also political factors at play, such as the unfair distribution of food and the high cost of healthcare. LEDCs suffer from malnutrition more due to those various different root causes that is very prevalent in most of the LEDCs. However, the Millennium Development Goals and the currently running Sustainable Development Goals have made significant progress in tackling this issue. Since 1999, followed by the implementation of the MDGs, over 1 billion people have been relieved from a state of extreme poverty. This has most definitely helped countless families to be able to feed their children and to free them from the issue of malnourishment. However, the recent outbreak of COVID-19 has ultimately reversed the progress we have made by a considerable amount. In the very first year of the pandemic alone, over 6.7 million children under the age of 5 years old were driven into the state of malnutrition. This is a shocking 15% increase from pre-COVID times, and this number is still rising as we speak. Not only are more children suffering, but an estimated increase of 10,000 children are dying each and every month due to the impact of the disease. Most of us happen to be very privileged individuals, and we often take it for granted when we come home faced by a table full of meals. Millions of people dream to have the life we have. It would only be fair for us to do what we can to help tackle this issue, no matter how small our actions are. We can start by simply trying to reduce wasting food, which is a major cause of why there are people with lack of access to food, despite the facts and figures stating that there is enough food produced in the world to feed more than the population. This is an issue we can have an impact on. This is a call for action. We look forward to working with you in debating solutions to tackle this problem in MSMUN 2021.